So today we will be focusing on basic human needs. This presentation is brought to you by San Diego PACE, San Isidro Health. And basic human needs, that's just something that everyone needs to survive and function. You probably already know um, that not much has changed since the beginning of time, right? We're human beings, so we still need the same things our ancestors needed in the past. So for today's agenda, we're going to focus on the basics, a few theories, and we're going to dive in a little deeper into the theories and then a brief summary. So for today's introduction, as human beings, we have essential human basic needs that need to be met for us to thrive and create the life we desire. We must have these basic needs such as food, water, air, and shelter to survive. If it's not met, then human beings may become extremely ill or perhaps even die. We have many other needs to meet each day and every day to help us continue to function. A brief review of theories of needs will address how meeting basic needs unlocks your potential to achieve higher level goals. Okay, so what is a need? Can you tell me what is a basic human need in your eyes? Well, let's see here. Let's see what a need is. So, how would you define a human need? How do you quantify a human need? Well, one of those for some people might be happiness, for others success, and for all of us survival. And of course, there's wants and then there's needs, correct? And defining needs. A need is something necessary for survival which you cannot live without, and it is required to maintain life and an internal state of well-being. Let's see what that says. Okay, needs are things that people require to survive. Again, physiological needs, food, water, shelter, clothing. And then there they are there, basic human needs. And if a human body does not have those required needs, the body cannot function and will die. A need is something that is a necessity you must have to survive. And a want, well, it could be something a person would like to have, but is not needed for survival, and we can actually live without a want. And remember, wants and needs are two different things. Yes, somebody said safety and health, correct. Okay, now let's kind of just go off topic a little. Oh no, you've been shipwrecked. You've been shipwrecked on a deserted island. What do we have to do in this scenario? We have to fight for our lives to survive, right? The elements. So once we make it to shore, we find the island, what's the next thing on our agenda? We have to look for water, right? So water is an essential necessity for human survival. The human body usually cannot live more than 3 days without water. The body needs lots of water to carry out many essential functions such as balancing the internal temperature and keeping cells alive. Water also helps the body remove the toxins from cells and excrete them through urine and breath. Without water, the body cannot do this efficiently, causing toxins to build up. And without water, the body cannot function correctly, and you will begin to stop working. This can result in dehydration, and it occurs very quickly. And remember, our body is made up of 75% water. So let's see what happens when we are dehydrated. So we know that dehydration sets in pretty quickly once it starts, right? snowballs, and dehydration can be mild, moderate, or severe, depending on how much fluid your body has lost. The effects and symptoms can vary from person to person, and it can include, well, early symptoms. In the early stages, you will be extremely thirsty, perhaps have dark colored urine, dry or sticky mouth, and have a headache. Mild to moderate, your skin will be dry and cool. You'll start feeling tired, fatigued, exhausted. You'll have muscle cramps, and you'll start to get dizzy and lightheaded. Severe dehydration, you're no longer urinating. Your dry is shriveled, so when you pinch your skin, instead of it having the normal elasticity and it going back in place, it will stay shriveled. And you'll also have irritability or confusion and perhaps a rapid heartbeat. Other signs, well, you heard that term before, cotton mouth. Your mouth is extremely dry. You can't quench your thirst. Again, rapid breathing or fainting. People sometimes will develop sunken eyes, and others, their fingertips will get white. So let's not ever get dehydrated. And how do we prevent dehydration? Well, how much water should you drink each day? Our daily fluid intake, according to the U.S. National Academics of Sciences, Engineering, and Medicine, determined that an adequate daily fluid intake is about 15.5 cups, which is 3.7 liters of fluids a day for men, and 11.5 cups, 2.7 liters of fluids a day for women. So now that we know, let's drink up like the picture says there, water up. Let's get that fluid intake in our bodies. And remember, food is life. Nutrition is one of the basic necessities of life. Food contains nutrients, substances essential for the growth, repair, and the maintenance of our body tissues. Nutrients provide the energy our bodies need to function. And what happens during the first 24 hours without food? Your glucose storage is depleted. By the second day without food, you will begin to break down muscle tissue to provide for energy. You'll start to feel weak, you're fatigued, you will have stomach cramping, nauseas, you'll be irritable, faint, and after a long time without proper nutrition, serious issues can occur, and this is like months and perhaps years. People can develop anemia, which is low iron, or have low vitamin D, or lack of calcium, which will make your teeth brittle. So let's make sure that we are eating appropriately every day and getting our nutrition for our health. And to prevent excessive muscle loss, well, the body begins to rely on fat stores called ketones to create energy. This process is known as ketosis. The length of time that a person can live without food also varies depending on the size of the person and how much daily intake, fluid intake they take every day. So now, that was basically the physiology part of our survival. So now we're going to get into a few theories here, the fundamentals. Scientific theory defines basic human needs into three categories: physical needs, we just discussed, emotional needs, and social needs. As healthcare professionals, we must understand human needs to be able to cross language and break communication barriers, and also anticipate our needs and others' needs, and also adjust how we care for ourselves and others. Okay, so on this slide, we're going to talk a little bit about Mr. Maslow. So in 1943, Maslow developed a hierarchy of needs to explain the 5 levels every human being must progress through to self-actualization. Abraham Maslow's hierarchy of needs is one of the best known theories of motivation. The human essential needs are, again, physical, emotional, mental, relational, soul, higher self, and spiritual needs. These needs align with Maslow's hierarchy of needs. And Maslow's theory states that our actions are motivated by certain physiological and psychological needs that progress from basic to complex. Has anybody ever seen this movie here, Soul? It's a Pixar Disney movie. Okay, so this movie is about this gentleman briefly. He's a musician. He finally gets this big break, right, to go and play for like I think like a jazz musical. And he's so excited and so happy. And on his way home, he falls through like a little tunnel that's on the sidewalk and ends up passing away. Um, he goes into the next life and he's upset because he didn't get to accomplish his dream and his goals, right? So he finds another he finds another soul on that what is it in the afterlife, soul 22. So he comes back with soul 22 to earth to accomplish his goals. So this movie really caught my attention because it's very important as human beings. We all have goals and achievements that we'd like to accomplish, which is self-actualization. So now we'll get into the next slide about self-actualization. So theories, Maslow's hierarchy. It's a motivational psychological theory in which human needs are ranked in 5 tiers, ascending and the ascending model. Tiers are not fixed but met in order for one's own motivations. Each tier contains a mix of basic survival and social necessity. So as we can see here, our physiological needs, everybody needs food, water, shelter, etc. And everyone needs safety and security, love and affection, self-esteem, and self-actualization. So our next slide will kind of break it down a little bit more. Let's see here. So for physiological needs, again, food, water, shelter, and that's down at the bottom. Everybody needs that for survival. And the next step over is safety and security. Most of us need to be able to be financially secure, seek employment, financial security, general health and well-being, maybe ownership of property, also to live in a safe neighborhood or community. Love and affection. We all love giving and receiving attention. Also have a sense of family bonds, social acceptance, friendship, and community. So it's just kind of going up the ladder. And then self-esteem. We all need confidence and able to achieve our goals and be recognized and also be appreciative and receive respect for ourselves for our achievements. And then self-actualization, that's our creativity, our critical thinking, our problem solving, maybe perhaps some philosophy, art, or basically pursuit of happiness. So it's kind of ascending up these pyramid blocks here, and it doesn't necessarily for some people that it doesn't have to go in this precise order. Someone can, you know, have their physiological needs met and then they could just ascend all the way up to self-actualization so they don't necessarily have to have all of these in order. And again, this picture here kind of just helps me look at the bigger picture a little bit better on that Maslow's hierarchy of pyramid. When I look at this, I think, okay, physiological. Everyone needs, you know, food, water for their survival. And if they don't have it, we're human beings. We kind of provide for others that are less fortunate. And for safety, we establish personal security, coming home every day to our home and feeling that security is, it makes us feel comfort. And also loving and belonging, it's cultivating social connection and self-esteem, earning respect through achievement. So I looked at this picture and I thought, wow, she really worked hard to get to her goals, right? And self-actualization is exploring and realizing your potential. Nice to see the graduates with their diploma and their smile. And now let's compare their needs. This is a movie called Moulin Rouge. I've never seen it, but in this movie, this gentleman seeks love. So for him, earning love is more important probably than anything on that pyramid. He's seeking truth, beauty, freedom, and above all things, love. He puts himself in a dangerous position, all for love, friendship, philosophy, in his career. I didn't watch the movie, but then again, I've kind of got some information from other participants about the movie. And so where does he live? He lived in a theater where this lady was a dancer. He fell in love with her, and he lived at the theater because he didn't have much income to pay for housing. And where did he get his money? Well, he was in acting, so he probably was starting out an acting career and was receiving like the basic minimum wages for acting. And was he clothed and sheltered? Well, yes, he was clothed. He wore the theater costumes and he was sheltered. He lived underneath a theater somewhere in a room that wasn't really utilized. So he did have all his needs met, but again, his most important need was the love and acceptance of his other star female friend. Sorry, I'll go back to the slide. And for those of you that have seen Castaway, this gentleman was stranded on an island. What does he first do when he gets to the island? Well, he looks for water and then he finds food and he creates a shelter so his physiological needs are covered. Also, he creates a system to survive. So he picks up little cans or empty coconut shells and collects water. He also fishes for food. And once he establishes his survival, he seeks companionship. Um, he basically found a volleyball and he had a cut on his arm, and with the blood of his arm he created this little face, and he would talk to the ball every day. So here it shows us that companionship and socialization is important because he was basically going insane from just not ever talking to anyone using his voice. And once he created this little character here, he was able to speak to it every day, and he even came up. He was even creative by his socialization to create an escape and rescue plan. And the whole time he was on that island, he pretty much lost sense of time and communication until he made this little guy here. And he basically lost sense of everything being by himself. So it's important for us to socialize and use our voice every day. And so now this is another theory. It's Virginia Henderson's nursing needs theory. This theory is based on Virginia Henderson's practice and education in the field of nursing. Her theory assumptions that nurses and caregivers care for a patient until the patient can care for themselves or until a peaceful death, and the patient's desire to return to health. That's something natural in patients. You know, they want to eventually recover from their illness. And nurses and caregivers are also willing to serve and will devote themselves to the patient. And the mind and body are inseparable. Therefore, nurses and caregivers should be educated in both science and the art of humanities. Again, Virginia Henderson's need theory. There are 14 components of the Henderson nursing need theory, and that is for patients to be able to breathe normally, for them to eat and drink adequately, for them to have proper bodily elimination, bodily waste, and move and maintain desirable positions, to get enough sleep and rest, and select suitable clothes, dress and undress, assistance with undressing, and to maintain normal range of body temperature. Also to keep the patients clean and groomed. I'm sorry there again. And avoid dangers or endangering others or even the patients. Communicate with others to express emotion, needs, fears, and opinions, and the ability for the patients to worship according to their faith, and to work to achieve a sense of accomplishment. Play or participate in recreation, like our participants in the day center, and also to learn and discover and satisfy curiosity. Let's dive in, helping others. So how can we meet the needs of our patients? Well, according to physiological needs, providing nutritious meals, assisting with feeding, proper hygiene, providing medications and pain relief, and supporting daily activities of living, ADLs, and to provide safety and security. How? Well, by providing a safe environment, reducing hazards, wearing masks when needed, washing hands and sanitizing the workplace, and also addressing medical issues and concerns, receiving consent or explaining procedures, also honoring patient privacy and personal space. And in regards to social needs, treating all with dignity and respect, providing socialization activities, encouraging conversation and connection, and self-esteem, maintaining independence and providing praise, involving participants in decision making, assist with grooming and appearance, and finally, self-actualization, allowing for spirituality, religious practice, and personal values, opportunities to be creative and explore and learn, and offering support regarding death, dying, and grief. And let's not forget, rule of thumb, sunlight. It helps boost the chemical in your brain called serotonin, and that can give you more energy to help you keep calm, positive, and focused. Doctors sometimes treat seasonal affective disorder called SAD and other types of depression linked to low levels of serotonin with natural or artificial light. Remember, sunlight naturally contains vitamin D, which is necessary for the body to absorb calcium and bone support health. And humans need an adequate amount of light. Perhaps taking a walk on a sunny day along the beach, hiking, all this uplifts and enhances our mood. With proper precautions, sunlight exposure can have many benefits, especially for older adults. Always use sun protection. Don't forget that. And remember, all life forms need energy to survive, and on Earth, most of that energy comes from the sun. Well, thank you, everyone. We are down to our summary. Let's go over our summary. So human need theory is dominated by two theories, and we covered that. Maslow's hierarchy of needs, physiological motivation, and Henderson's nursing theory. And both theories address physiological need, emotional need, social need. These need theories can be applied in the workplace with participants, patients, and even our families, and the workplace with colleagues, and our own personal life, our self-needs, family, and friends. And thank you, everyone. I hope you enjoyed today's presentation on basic human needs. And here are just the resources for our presentation today. I do believe I forgot to mention my name. My name is Grace McCullough. Some of you might already have um, known me from past presentations. So I hope you have a good weekend and I hope you enjoyed today's training. Any questions? I'll hang around for like another 5 minutes. And then everyone's can feel free to go if you don't have any questions. Thank you. All of you are so very welcome. Have a very, very nice weekend.